Some things that you should take into consideration when considering being a surrogate. So, not only are you putting your body at risk by becoming pregnant and carrying a baby, there are also a lot of other things that you need to consider when you are potentially going to be signing up for this kind of thing. You know, most surrogates are 90% sure that they are done having children of their own. I am an exception. I feel like because I'm an only child, I've been on the fence about having another baby for so long because I want my kids to have each other, but my husband is like, no, we're good. So I'm trying to also be on the same page with him. That doesn't affect my decision to be a surrogate. So what I mean by that is when you choose to become a surrogate, you are saying, yes, I understand the risks that are associated with this, and not just, fetal loss or, a failed transfer, things of that nature. There are also potential risks of losing your reproductive organs. There are unforeseen circumstances that could lead to a hysterectomy, a partial hysterectomy, loss of a tube, loss of an ovary. These things are going to inhibit your ability to conceive naturally, which for most of us, that's what we're used to because we're super fertile. And so you need to make sure that you're okay with the potential of being told you're not going to be able to carry any more children. And I think that is something that a lot of people don't take into consideration. I think they go into it and they think that, oh, my pregnancies were perfectly normal. I don't think that I'm going to have any complications. And while that is mostly true for the majority of us, there are the exceptions to every rule. And you could end up in a situation that puts your health at risk and where, carrying another pregnancy after your surrogacy might not be ideal. It might not be possible. So you definitely need to take that into consideration. And you also need to take into consideration how long a surrogacy journey takes. So from the time that you get matched until the time that your pregnancy concludes is not always, a smooth transition from match, transfer, baby. It doesn't always work like that. While we go into it and we hope that is how it's going to play out, there are a lot of factors to, consider when you're looking at that. So you want to make sure that it's not going to be something that is going to coincide with something, going on in your life that you don't want to be pregnant, can't be pregnant, whatever the situation may be, that, is potentially hindering your plans. So, you just want to make sure that you've done your research, what kind of risks are associated with this type of thing. Make sure that your doctor is okay with you being pregnant again. Make sure that you're okay with being told potentially that you may never have children of your own again. Make sure that your timeline is flexible. It's not something that hard and fast rule have to be pregnant, have to be concluded by this time, because sometimes it doesn't work out that way. So you just really need to be flexible with a lot of different things, and you need to be mindful of a lot of different things as far as considering a surrogacy journey for yourself.